Hey, Sophia. Hi, everybody. Thank you for joining us. We are getting ready for a Q&A live session with myself, Dr. Deigni, board certified plastic surgeon in Houston, Texas. This is our phone number, 281-724-3138. Keep that in your contacts. Call us, text us, GG1122. Nice to see you. Call us, text us, and we'll be happy to get you guys in for your consultation, either in person if you're in the Houston area or able to travel to Houston, or we would start with a virtual consultation if you're unable to travel to Houston. Go ahead and Fatumata Mama, thank you very much for joining us. Go ahead and share the link with your friends. Also, there is a lead form on the bottom left of your screen. TikTok had been updating their form, so it had been unavailable for the past week and a half or so. And so we're very excited that it's back on. So please use that feature as well to share your contact information with us and what procedures you would like to have done. We are very excited and looking forward to taking care of you. Of course, call us, contact us anytime, and we will be happy to give you some information on what procedures you're wanting to have done. Also give you some kind of an idea of what your budget would be. All of these procedures are paid out of pocket. They are not covered by insurance. And our patients also take advantage of the various financing options that we have available for them. We offer patient fi, care credit, Alpheon financing, and charity financing. So those 4 financing options are always available for our patients. La Rue, asking about what about thighs? Absolutely. I do thigh lift surgery for my patients. Again, I do all body contouring procedures. So it includes the mommy makeovers, the body lift, thighs, breast, liposuction, and all of that. So definitely contact us, put in your information in the bottom left of the screen there. We will be happy to have you come in for a consultation. There are 2 types of thigh lifts that I'll do. And it basically is dependent on and that's actually the surgical type. There's also the non-surgical type or the non-skin excision type, I guess I would say. So if you have a lot of excess loose skin, mostly in the top part of your thigh, then I will keep the incision hidden in the groin area. And that's one type. The other type is if you've got a lot of excess loose skin that goes all the way down to your thighs, then what I will do is extend that incision from the groin all the way down the inside of your thigh, down to your knee, to really take advantage of removing all of that excess skin and fat so that you have a much nicer contour. That's the second type of thigh lift that we do. Every so often, we will have patients that come in that really don't need that much skin excision, so they may not need the actual scar that goes in the groin crease. But what we can do is a combination of liposuction and some skin tightening with the Renuvion J plasma. And so that's, I guess, the third type of thigh lift that we offer our patients. That is not placing large scars around the thighs. But of course, everybody is different, and it all depends on what you present with, what your personal goals are. And so definitely contact us, share the link with your friends, tell them that we are live discussing these body contouring procedures, and then also put your information in the bottom left of the screen there. Jackie Marie, I just saw you popped in. Thank you very much for joining us. I won't complain. Okay, I want a body lift. Oh, wonderful. We will be happy to take care of you. Nice to see you, Jackie Marie. We will be happy to take care of you. The body lift is a procedure that includes all of these 4 procedures: the monsplasty, the jointless tummy tuck, which is my signature procedure, hip lift, and butt lift. So the scar goes all the way around the full body. So this patient here underwent this body lift procedure. It helps to treat the outer thigh sagging, the butt sagging, the hip. Also, of course, I take care of the body, the belly area, and the monsplasty, the fupa area. And specifically for this patient, because she's got so much excess loose skin, I did a fleur-de-lis technique, which places the scar in the midline there. Makes it really, really nice for her to actually remove as much excess tissue and give her a beautiful, beautiful change in her body. And she is thrilled. Shelly Shell, do you do celebrity arms? I'll do anybody who is able to qualify for these procedures. Absolutely. So contact us and we will be happy to examine you and decide which procedures you will benefit from. Some people, for the arm lift, they will benefit from this incision that is hidden right here. I believe I have got one a patient who came in, she wants to have that done sometime this summer. So the scar will stay in the armpit area. Most patients will need the scar that goes from the elbow all the way into the armpit because they've got a lot of loose skin there. A few patients will have more loose skin that goes all the way up into the forearm. And sometimes we will extend the scar and go from the forearm all the way into the armpit. So it all depends. Kenem is asking, do you have a price list? So call us, contact us, and we will be able to give you kind of like a ballpark estimate for the procedures that you're wanting to have done. Everybody's different. So there's no cookie cutter procedure. The drainless tummy tuck will start usually at $13,000, but the pricing and the final quote will depend on the individual person because it all depends on what surgery you've had done. It depends on what procedures you're wanting to put in. So, okay, I need a tummy tuck, lipo in my back, arms, and boob lift, as well as a thigh lift. Exactly. So depending on what type of surgeries we need to do, because there are different types of treatments for each of those areas, we'll be able to give you a specific quote based on your examination. When I examine you and I see you, and I can tell how long the procedure is going to take. And so we definitely have to go through that conversation and examination so I can give you as accurate of a quote as we can do. And then that quote is good for 6 months. So for you guys who want to take advantage of these good prices that we have for this year, if you want to have surgery anytime in the fall or up to the winter, so up through December, definitely contact us. 281-724-3138 is our phone number. You can text us or call us during business hours, or if it's after business hours, just leave a message or just text us and we'll get back to you as soon as possible within the next business days. So thank you guys, everybody, for following us. And please don't forget, share the link with your friends. Let them know that we are live, taking questions about body contouring procedures, body makeovers, breast lift, breast surgery, liposuction, BBLs. I'm a board-certified plastic surgeon. I practice in Houston, Texas, and I specialize in aesthetic surgery. And I've been doing this for 9 years now, and I love it. I really enjoy taking care of my patients, and I was happy to actually have them also come back on TikTok and share their experience with us, and also allow us to film them, listen to their testimonials, and share that with you guys. So wonderful. Mrs. Leah 21, are there any before and after photos on your website? Yes, go to the website, DeigniPlasticSurgery.com. Over the next week or two, we're going to be working on updating the website photo gallery as well to bring more. You also will get to see some selfies of my patients. A lot of my patients there on the website have gone through their surgeries. They've actually given us some selfies, and we have a selfie gallery, so people really enjoy that. So definitely come and see us. We will be happy to take care of you. I also have other pictures that I show my patients also on an iPad when we do consultations. Of course, it all depends on your particular body type, what you're wanting to have done. So, but definitely scroll through our social media platforms as well. TikTok, Instagram, YouTube. We have before and after pictures, some testimonials from our patients on all of these platforms, including our websites. Shelly Shell, where does the arm lipo start at? You mean Pricing wise, contact my office. My patient coordinator will be able to give you some estimates pricing wise. Thank you very much, Gayla Sullivan, for joining the team. I appreciate that. So definitely contact us, 281-724-3138. Shoot us a text, and later this week, tomorrow or Thursday, we'll be able to reach out to you and guide you through the process. Honeybee, I need a lipo 360 with a little bit of fat to my hip dips. We will be happy to take care of that for you. I really enjoy being able to contour those areas and fill in the hip dips for our patients and give them some nice opportunities to change their wardrobe and feel more confident in their body and enjoy, pretty much all social activities that they might want to enjoy. So definitely come in and see us. If you want to get surgery done soon, please contact us. We will be happy to get you booked for your consultation and get you booked for your surgeries. Vani Ramirez, thank you, Black Mamba. Appreciate that. Join the team. What are the BMI restrictions, or is that case? It's case by case, but the BMI max BMI is 35. So this patient she met the BMI requirements. She lost over 70 pounds, 70, 80 pounds, probably even more. I don't remember exactly, but massive weight loss. And BMI max is 35. She did extremely well. You can see the huge transformation before to after. And this now she's able to actually exercise even more and lose more weight and continue to work on her thighs. I think her next procedures will be to work on those inner thighs, so we can do surgery on that and get her much slimmer thighs. Gayla Salser, do you take insurance? No, our office does not take insurance. The majority of the procedures that we do are not covered by insurance. Our patients pay out of pocket, and we offer 4 different types of financing options as well for our patients who want to take advantage of those. We've got Care Credit, Patient Fi, Cherry Financing, and Alpheon. Brenda Harris, I had my consultation in office and can't speak enough on what a wonderful experience I had. Wonderful. So happy. Thank you for sharing that with us, and we look forward to taking care of you guys, okay? Honeybee, will a board-certified anesthesiologist be present and monitoring me the whole time? Yes, we have teams. We have both board-certified anesthesiologists, and we also have CRNAs who are supervised by the board-certified anesthesiologist. We have 2 of those types of anesthesiology providers on our team. Kelly, what does BMI have to be? Max BMI is 35. So it all depends on what your height is. So for example, I'm gonna give you a couple of examples. If you're 5 foot tall, your maximum weight will be 179 pounds. If you're 5'2", your maximum weight will be 191 pounds. If you're 5'4", your maximum weight will be 204 pounds. If you're 5'6", maximum weight will be 216. I've lost 300 pounds, weigh 235, and need skin surgery. Congratulations on your weight loss. So if you're 235 pounds, if you're about 5'8", or 5'9", you will qualify for the BMI max, the max BMI. But we will definitely be able to have you come in. Like I said, it all depends on. I do it on a case by case as well, because I want to see where you carry that weight. Some patients may have deflated arms, deflated breasts, and deflated bellies, but they carry most of that weight now that's left in their thighs. We can start with other areas. So we can start with the arms, we can do the breast, we can do the belly. And then over time, they'll continue to lose the weight, and then it will affect their thighs where they can lose that, and then they can come back to get their thighs. So it's on a case-by-case basis. But definitely, general cutoff, BMI 35 is a max. Romeo, do you change the same quote for procedure based on BMI? No. So the quote is based on you. So it's a personalized quote. So you won't get the same quote for the same procedure as somebody else because it's based on you. You may have had previous surgery, which will affect how long the procedure will take because of scarring, how difficult the case can be. So those are factors that we look at because anesthesia facility charged by the minute, by time. So I have to be able to examine you, know what I'm going to anticipate. If you have hernias, if you have scar tissue, if there's things that are going to be making the case longer than normal, that is what's going to help kind of like allow us to give you a better quote, like more accurate quotes. But we won't change it necessarily just because of BMI. So, like I said, it's based on you specifically. When you come to see us, I examine you and we can see how long and what we need to do. Katina Clanton, 5'3", 178. Perfect. You would qualify. You would be less than a BMI of 35, so you can come in and we can do your surgeries as long as you don't have any other medical problems that will not allow you to move forward. So it could be uncontrolled diabetes, uncontrolled high blood pressure, uncontrolled thyroid issues, or immune problems. So definitely autoimmune problems. So we need to make sure that your medical problems are well managed, and then we can go ahead and get you on the books. So contact us, 281-724-3138. Nene is asking, how do I get a quote? Very easy. You can text us at this number anytime, or there should be a form on the bottom left of the screen here on TikTok where you can put in your information, name, phone number, email, and then what procedures you're interested in. And then my patient coordinator will get that information, and later this week she'll reach out to you and then give you some more information about our process and everything. Do you offer virtual quotes? So if you're not in the Houston area, we will start with a virtual appointment. So you will meet with me. We will go through your history, your medical history. We'll go through the treatments that you want to have done, and we will develop a treatment plan for you. At the end of that virtual consultation, you will get a quote. Yes. Vani Ramirez, what role does Ozempic play in getting a surgery? Thanks. So Ozempic will help you, or other GLP-1 medications. So we do semaglutides. It will help you to lose weight. So it can help a patient, and we'll put our patients on our weight loss revolution program to get them to the target weight. So if you need to lose 20 or 30 pounds or so, and you need that extra help, we will put you on some GLP-1s, so Ozempic or semaglutide, and you will be able to start losing that weight. I will have my patients stop those shots 3 to 4 weeks before surgery to allow their stomach to be cleared up fully, so that we can minimize any kind of risk of problems during surgery. Chef Liz, for you, what about anemia, low iron? Yes, I've had patients who have come to see me, and I do blood tests on all of my patients. It's part of the standard safety workup. And if you have low iron, iron deficiency, anemia, we will make sure that you see your hematologist or your primary care doctor so that you can get iron supplementation and bring your hemoglobin levels up. I had one patient, I just operated on her. She looks fantastic. She had a drainless tummy tuck and a monsplasty. I saw her, I think it was last week I saw her. She was 1 week out from surgery, actually 6 days out from surgery. She had been on a schedule about 3 months ago, or she came in for a consultation, wanted to have surgery fairly quickly. We're going to have a very quick turnaround time. We did her labs. She was found to have anemia, iron deficiency anemia. It took about 2 to 3 months to get her hemoglobin up to where we needed to be for safe levels, and then we proceeded with surgery. And she's very, very happy. Honeybee, since I'm tall, will the fat transfer to my hips still look natural and balanced for my frame? Yes, so it all depends. I place the fat so that we give you a contour that you want. So we discussed that during your consultation. I ask you to kind of show me what you don't like about your hip dips or your shape, your frame, and then we kind of go through all of that so that I have a mental image of what you like. Again, it's not cookie cutter, like everybody gets the same thing. I really take the time to listen to my patients to understand what you specifically like for your body, and then we go ahead and give you those results. Chef Liz, for you, tummy tuck only with lipo to back. What about arm lipo? Yes, definitely. You can come in for your consultation, and we'll be happy to get you to do that. We can combine all of those procedures together and give you a nice contour. So contact us. This is our phone number, 281-724-3138. You can text us, call us, leave a message if it's after business hours, and we will get back to you. Or put in your information in the bottom left of the screen. The form has been reestablished. TikTok, I think, has been working on their lead generation form for the past 2 weeks. So it was kind of like absent from my live sessions, but now it's available. So put in your information there as well. Dually 0629, I had bariatric surgery, went from 265 to 155-ish, 5'6". Congratulations. So 5'6", 155, you absolutely will qualify for these body contouring procedures, and I'll be happy to take care of you, help to remove that excess skin that you have. Most likely you will really benefit from the body lift because losing that much weight will leave you with a lot of that excess loose skin, not only in the belly area and the fupa area, but also in the hip and the butt area. So we will be happy to see you. Come in and book your appointment, and we will take care of you. Yes, yes. Oh, thank you so much, Jackie Marie. I appreciate your support there and your comments. Flowers, so. Doctor, what do you recommend for deep nasolabial fold after buccal fat removal? Fat grafting lift? Yes. I would probably have to see you, but just based on what you're telling me, I would recommend some fat transfer, some fat grafting. So come in and see us. I'll be happy to examine you, and we can offer that fat transfer to your face to restore that balance. Mrs. G, what if you are from out of town? Absolutely. We see tons of patients from out of town. I think over 50% of our patients travel from out of town to come and have surgery with us. So it's amazing. We will start with a virtual consultation for all of my patients who are from out of town, out of state, or even out of the country. So Ms. Wright 337, I don't want the tummy tuck belly button. Okay, so definitely look at the belly buttons that I provide for my patients. I would say probably 95% of my patients will absolutely say they love their belly buttons. So definitely look through my before and afters, look at the belly buttons and see if you like them. If you like them, then come in. I have a lot of patients actually choose me because they love the belly buttons. They're not like, really wide with big scars. They tend to be relatively cute and really nice and proportionate to the patients. Of course, everybody heals differently, but definitely look at my results. And if you feel like the belly buttons look acceptable to you, by all means, come and see us and we'll be happy to take care of you. I also do, like I said, I do the drainless tummy tuck. So yes, I'm glad you do. You love yours, Jackie Marie. Thank you. If I do the drainless tummy tuck, so the drainless tummy tuck is a technique that not that many plastic surgeons do. It really helps to minimize your risks of complications. So like seroma, fluid buildup, it actually allows you to start healing much faster. My patients typically for their recovery after a tummy tuck, a drainless tummy tuck, will be able to walk upright within the first 3 to 5 days. Typically, when they come back to see me a week after surgery, they're off their pain meds. They're driving themselves into the office, and they're able to go back to work right after that first week. Most of them have probably started going back to work as long as it's from home, remote work, and they really love this new technique, or it's a game changer for them. I've had some patients who've had surgery with me, and their friends have had surgery the traditional way with drains from other surgeons, and they have compared their post-op recovery, and my patients have always recovered much faster, and they love it. Relaxed. How is it that your patients don't require drains post-op? Exactly, because of the technique that I do. So I don't do the traditional technique where you actually put drains in and remove the fluid that's going to accumulate. I actually anticipate and fix that problem before it happens. I do a lot of suturing. I put plenty of sutures, stitches all the way inside this area to really close everything up so that your tissues are able to start healing immediately after surgery. They don't have to wait 2 or 3 weeks for that fluid to go away to start meeting and healing. So that really bypasses that whole process and it accelerates your healing process, which is fantastic. So my patients are very happy. There's minimal swelling. Go again on my TikTok. You'll see a lot of testimonials, 1 week results, where you can see there's very minimal swelling in my patients. They're standing upright, feeling amazing, and these are all game changers. Kerry Thompson, 158. Do you work with out-of-town patients? Absolutely. Like I said, over 50% of my patients travel to come and see me. They travel from all over Texas, all over the US, from many, many other states. So definitely contact us. We will be happy to take care of you. This is something that we do routinely. The way I do, again, my procedures is to make your recovery process as easy as possible. You do not need skilled nursing facilities. You don't need a nurse to recover you. We ask that you come with an adult who will be with you at least for the first day or two after surgery. Usually after that, you're able to start taking care of yourself. Kelly, how bad is the pain level? I don't deal with pain too well. For all of my patients, whether I know everybody deals with pain differently. Regardless, I want to bring your pain level to a 3, maximum 4 out of 10, which means you're a little bit sore, but you're comfortable enough to be able to sleep. You're comfortable enough to where when you move, you're like, oh, I feel like I had something done, but you're not, your heart rate's not racing. You're not like so uncomfortable that you're, having nausea or vomiting or unable to sleep. So we treat your pain based on your tolerance. So all of my patients, our target is 3 or 4 out of 10 max. Kenyan woman, I have autoimmune disorders. Is it safe for patients who have autoimmune diseases? It depends on what type of autoimmune diseases you have. I've operated on patients who've had autoimmune diseases before, and they've done very well. We need to make sure that your diseases are well controlled, that you're not having any kind of active flare-up during the perioperative period. So we optimize you. So your rheumatologist, hematologist, or other doctor specialists that might be taking care of your autoimmune disease will help to optimize you so that you can be ready for that period of time where you're going to be having surgery and then healing. Relaxed. Will you be able to sit down after your procedure, or do they require a specific pillow? So for a body lift, you're able to sit down because we're not doing any kind of fat transfer. You will require a specific pillow if we do fat transfer to the buttock area and hip area, but mostly to the buttock area, because you don't want to be putting pressure on those fat grafting sites, because you want to allow those fat cells that have been transferred, you want to allow them time to actually reestablish their blood supply so that they can be able to survive. Honeybee, my labs showed low blood count. Will that affect surgery, and how do I fix it before then? So again, if you have iron deficiency anemia, you need to increase your iron levels. The way to do that, I would say, is definitely go see your primary care doctor. If they are able to take care of that, they will do that. Otherwise, they will give you a referral to a hematologist who's a blood expert. They are going to really analyze your results to see what type of deficiency you have, and then they'll be able to give you those supplements, or at least help you get that hemoglobin level up. Yes, my cutoff for these big procedures will be no less than a hemoglobin of 10. Anything less than that, we have to get it up. Iris and Pete, 1996. I had heart surgery. Would you still see me? You have to tell me more. So what type of heart surgery you had? Are you healthy? What's your health condition right now? So if you've had heart surgery, but you're able to, walk 5 miles without having any pain, any problems, or you're able to walk 10 flights of stairs without any problems, you might actually be fine. So we will have to do some tests, and we'll have to get clearance from your heart doctor, your cardiologist. And as long as you pass with flying colors, yes, we will be able to see you, and we will be able to move forward and take care of you. Relaxed. Do you need massages post-op? Not if you don't get liposuction. So for these body lifts, the drainless tummy tuck, all of these types of procedures where I do excision without doing um, uh, liposuction, you don't need massages. But once we do include liposuction, so lipo 360, liposuction to the arms, liposuction to the thighs, then yes, I would have you do lymphatic drainage treatments. They call me Gen Z. Sorry, I just joined. Does insurance cover? No, insurance does not consider these medically necessary procedures, so they don't cover these procedures. They will consider these to be elective procedures, meaning you will have to pay out of pocket. All of my patients pay out of pocket, and we offer 4 financing options as well if you want to take advantage of those. Give us a call, 281-724-3138, or text us, or put in your information in the bottom left of the screen there. We'll get back to you. But we do offer care credit, Alpheon, Patient Fi, and Cherry financing. Kelly, have you ever done surgery on someone who is missing a lobe in their lung? I've had many surgeries. I don't think I've done surgery on somebody who's missing a lobe on their lung. But again, we have to do adequate testing to make sure that you will be fine. So if your pulmonary function tests show that you are well oxygenated, you're doing well, and there's no issues with your heart, your cardiovascular system, and we get clearance from your doctors, we will be able to move forward and do the surgery. Gemini credit and funding. Do you do the new way if a tummy tuck where you don't have to tighten the inside? So I guess you're talking about the muscle repair. So the separation of muscles. 99% of patients who are getting tummy tucks have separation of their ab muscles and will benefit from the repair of their separation of muscles. If you choose not to have a separation of muscles, I don't have to do the repair of those muscles. But we definitely discuss that. So if you say, no, I don't want to get it, I will just make sure we note it. We've talked about it, and then proceed with that. Iris and Pete, 1996, yeah, triple bypass surgery. Again, so for that, we need to make sure that your heart is actually able to undergo general anesthesia and withstand these types of stresses on your body. So you will most likely undergo a stress EKG to make sure that your heart is good. If it's doing great, there's no sign of ischemia problems or a heart attack, then we will get a clearance from your cardiologist and we'll be able to work on you. Becky Lynn, can I do a mommy makeover with just lipo 360 and a tummy tuck? Yes, a mommy makeover will include, those are things that will include in a mommy makeover. A mommy makeover is a term that encompasses multiple types of procedures that are specific to you. So what you just listed, tummy tuck and lipo 360, will be your mommy makeover. Some others might add fat transfer. So tummy tuck, lipo 360, and fat transfer, that will be their mommy makeover. Some others might have tummy tuck and breast lift. That would be their mommy makeover. So mommy makeover is kind of like a generic term. Sheila Wright, what is the recovery time? So for a body lift, I do a drainless technique. So you have no drains at all because I take the time to put meticulous stitching all the way around the whole area so that it minimizes your risk of seroma formation and increases your ability to walk faster, decreases your recovery time. So most patients from a body lift procedure will wean off the pain meds around 5 days. They come back to see me a week after. They're typically walking upright or very close. And usually by week 2, they're able to go back to work as long as it doesn't require any kind of heavy pushing or lifting and heavy activity work. But if it's desk job, they'll be back at work. They'll be back at the gym usually around 2 to 3 weeks, walking, doing light aerobic exercises, so walking on the treadmill, and then back in the gym usually around 6 weeks and doing light resistance training. Contact us, 281-724-3138. Put that number in your phone and shoot us a text or call us and leave a message if it's after hours, and we'll get back to you. Renea 254. What about diabetics? Yes, I've operated on people who have type 2 diabetes. We have to make sure that your hemoglobin A1C is 7 or less. I've had some patients who've come in and they say, yes, they've got their doctor who's taking care of them, and they think their diabetes is under control. But then when we do the blood tests, it is out of control. It's a 9, 10, 11, 12, even higher than that. So we got to make sure that your blood sugar is well controlled. Once it is, we can move forward with surgery. Sassy Shea 08. I want to do tummy tuck and arms for a mommy makeover. Exactly. That's another combination that I've had patients do. Tummy tuck and arms for their mommy makeover. So absolutely come and see us. We will be happy to take care of that for you. And like I said, I combine procedures based on what my patients present with and what they're interested in having done. So call us, text us, or put your information in the bottom left of the screen there. Sarah B 924, what part of town are you in? Okay, Houston, Texas. We're in the River Oaks part of town. So right by the St. Regis Hotel, if you know where that is, within the 610 loop. And then I operate at several surgery centers, one in Bel Air, and one right by I-10 West and the Beltway, right by City Center on Memorial City. Evan, how about pec sculpting for men? Yes, I do that as well. So I will use the combination of liposuction and sometimes even fat transfer to sculpt the pec for my patients. It all depends on what you present with, what level of sculpting you want to have done. For those men who have gynecomastia, so they have man boobs, I also treat those and remove the glands that kind of give them those larger breast appearances and make them a little bit self-conscious and embarrassed. But we are happy to take care of that as well. Text us, call us, or put in your information in the bottom left of the screen there. We'll be happy to take care of you. Penny for Peanut. I had gastric bypass and have lost a lot of weight. I have a lot of loose skin. Congratulations on your weight loss. Is it possible? I'm not sure there's another part of that question, but yes, we will be happy to have you come in. If you're not in the Houston area or able to travel to Houston for your in-person consultation, we will start with a virtual consultation, okay? Lupita Castillo, will I be able to do a mommy makeover with type 2 diabetes and blood pressure and cholesterol? Yes, I've operated on patients who have all 3 conditions that you mentioned, but we make sure that they're adequately controlled, especially the high blood pressure and the diabetes. Those have to be well controlled. Campbell, what is the cutoff age? Great question. There is no cutoff age. What I look at is mostly your overall health. I've operated on patients in their 50s, 60s, 70s, and they've done extremely well. I've had these big procedures even in their 70s. As long as you're healthy enough to undergo these procedures, age is not really a limiting factor. Yay! Lioness Skywalker, what if you had liver transplant surgery? Oh, that's a little bit more complicated because the main issue here is we want to make sure that your liver does not get rejected or fail. So that will require more coordination with your liver transplant team, your other doctors who are taking care of your conditions. So that's a little bit more involved, and that will most likely be done in a hospital-based setting. But yeah, definitely. If you're asking me if I have one, no, I've never operated on a liver transplant patient doing these types of cosmetic procedures. That one, Sunflower G. Any specials going on? Yes, the drainless tummy tuck is $13,000, which includes anesthesia fees, facility fees, and surgeon's fees. That price is going to be good for the next 6 months into December. So lock in your prices now. The quote is good for 6 months. Starting next year, the price will go up. So definitely take advantage of these good prices now. Doing some price shopping around the area and just talking even to other patients who've had some work done before they come to see me. They on average pay $18,000 to $20,000 for their tummy tuck. And it's not even the drainage technique, which is the upscale or the much better improved technique. So my prices are definitely a huge bargain, much lower. We will continue to give you guys that discount or great value, and then prices will be going up next year, starting January 1st. So definitely lock in your prices now. Come and see us. Get your surgeries now, summer, fall, and up into December. MJ Skincare. What about removing side back fat? Side back fat. So yes. So like a lipo 360, liposuction, kind of like doing the love handles, back, bra line area. Yeah, we can do that. Absolutely. As long as you're healthy enough to undergo these procedures, yes, we will be happy to do that. You can do liposuction to remove unwanted fat, stubborn fat. Some patients will want to have then fat transfer because we're removing that fat, but it's quality fat that we can use in other areas to rejuvenate those areas. We can give a little bit more volume to the breast if you want it. We can give a little bit more volume to the face to rejuvenate the face. I think there was a patient, somebody who asked earlier on this live about deep nasolabial folds and some loose, some deflation, I guess, of the fat in their cheek area or face. We can definitely transfer that as well. Some patients will want to rejuvenate the back of their hand, so we'll use that fat to rejuvenate that as well. There's plenty of uses that we can do. That one heart, sunflower, Gigi. What if your BMI is over 30? As long as it's less than 35, that's my cutoff. We will be able to take care of that. Turnaround time for you guys to have surgery, as long as you're healthy enough, it would be anywhere between 2 to 4 weeks to get you on the schedule, depending on which period of you want to have done. Because we do share the surgery center with 3 other plastic surgeons, so it can book very quickly. At 7630, double chin liposuction and the fee, please. Yes, we do chin lipo. Contact us for more information. We need to gather a little more information from you as well, and then we can give you some estimates for that. Mom 123, can you do lipo on fat located on the upper mid abdomen? Yes, we can do liposuction virtually almost everywhere on your body. So you kind of tell us where the areas are that you are having some problems with your stubborn fat, and then when I examine you, I can kind of let you know what areas will look good with what we can do, and then work on that. We'll be happy to take care of you. Brittany Girl Mom, TTSFI something. How do you feel about cool sculpting or air sculpting or minimal lower stomach fat? I don't provide those services. It may work in a very, very, very small subset of patients. I've had patients who've tried cool sculpting at other facilities, and then they end up coming to me to get liposuction to actually get the results that they want. Jessica, can you still have an abdominoplasty if you have mesh inserted between your muscles for hernia repair? Yes, I've operated on patients who've had previous hernia repairs done with mesh, and they have done extremely well. Beautiful tummy tuck, very nice. Results on my website. Of course, I don't mention the mesh and stuff like that because I don't want people to hone in on who that person specifically is for HIPAA reasons. But you can definitely see the patient has a pregnant look, and then we do the surgery, and it's nice and flat. So we'll be happy to take care of you and give you some beautiful results. Kelly, is it for a normal tummy tuck or more for massive weight loss? I need a lot of skin removal. I work on everybody. People who've had massive weight loss with a lot of skin to people who have a little bit of skin that bothers them need work done. So I do the whole gamut. You can go through my TikTok feed and look at the before and after pictures. Go to my website right here. Also check out the pictures that we have posted there. We're going to upgrade that gallery as well with tons of other pictures over the next couple of weeks. It does take time to upload and get everything up, but definitely go through all of my social media, Instagram, Facebook, and TikTok. Carrie Thompson 158. What is lead time? Lead time. I'm guessing maybe like the turnaround time for you to have surgery. As long as you're healthy enough, we could probably turn around and get you in within 2 to 4 weeks. It depends on what surgeries you're having done, how long those surgeries are, if the surgery center is booked ahead or not. Because again, like I said, there are 4 other plastic surgeons. So it's 5 of us that operate at this surgery center. And so it books up pretty fast. So definitely, as soon as you know when you want to have surgery, well, as long as you know the time frame. So if you want to have surgery, say for example, in late June, July, anytime in July or August, you want to come in now to book it and reserve it. Escufilon, SKU. Okay, I'm not sure how to pronounce that, but can you talk about how the surgery will assist with cellulitis? Okay, yes. So for example, you can see this patient here. She has a lot of, so it's not cellulitis, it's cellulite. Cellulitis is an infection. I think it's just autocorrect. So she's got a lot of cellulite here. Cellulite can present in different ways. The treatment that I did for her here was a hip lift and butt lift to actually remove all of that saggy tissue that's kind of pushing it down and causing those dimples. By pulling it up and cutting it and making it nice and taut, I've improved the look of her cellulite on her butt and hips. Terry Thompson 158. How do you pronounce your last name? Deigni. It's Deigni is my last name. Deigni, plasticsurgery.com. Dr. Deigni. You're welcome. I'm glad you guys are enjoying this Q&A session. I do this every Tuesday and Thursday, time permitting. Central Standard Time. Queen Sugar. Does insurance cover paniculectomy, and does the BMI still have to be max 35? So for those specific surgeries, those are very good questions. I've operated on patients who have higher BMIs than 35 to get just a paniculectomy. I don't take insurance. Our office does not take insurance, so my patients pay out of pocket. Some insurances will cover paniculectomy, so you want to definitely check with your insurance. If you want me to do your surgery, I'll be happy to. I do the drainage technique. It makes your recovery a lot easier. It will be on a case-by-case to see what your BMI is. I'll examine you and see if we can move forward. And then you will pay out of pocket. But insurance, you may discuss with your insurance and see if they'll reimburse you partially or fully. That one Heart Sunflower, GG. Is there a recovery center where we can get post-op? Yes, we can definitely refer you to some recovery centers. But like I said, the way I do these procedures is with your recovery in mind. You do not need nurses to recover you. You don't need a skilled nursing facility. You can recover at an Airbnb, friends or family, or a hotel, as long as you have an adult who's going to be your caregiver to help you out. Lizzie R, 27. I'm 5'3" and I weigh 185 pounds. I've lost 90 pounds. Congratulations. Would I be a good candidate? 5'3", 187. Yes, you barely made the cutoff of BMI 35. As long as you don't have any other medical problems that would make it inappropriate for us to move forward. If you have high blood pressure that's not controlled, type 2 diabetes that's not controlled, any other type of disease that's not controlled, we need to make sure that we medically optimize it, and then we can move forward with surgery. But yes, you would qualify. Text us 281-724-3138, and we'll get more information and get the ball rolling. Brains by desire. Do I need to come to Houston for a consultation? No. For our patients who are from out of town, and we do get a lot of them, you will start with a virtual consultation with me. So you will, perfect. Looking forward to hearing from you, okay? You will send us pictures of the areas where you're wanting to have treated. That way I can review them. You will also fill out your medical history so that I am prepared to discuss in detail your whole treatment plan. And then at the end of the consultation, the virtual consultation, you will get a quote. And that quote is good for 6 months for you to book your surgery during that time. Carrie Thompson, 158. Will old cholecystectomy scars from previous keyhole surgery be more visually apparent? after a mommy makeover? It depends. It depends on where exactly that scar is, how high it is, and things like that. I've had some patients who've come in who've had old cholecystectomy scars done, and you can see one of them on my, I think she's on my website, but I definitely have her on my iPad. And you can see the scars gone completely. So it all depends on what you present with, where they are. It could be an appendectomy scar or a cholecystectomy scar. It depends on how much tissue laxity you have, how loose it is. If I can actually pull it all the way down and hide it nice and low, I would do that for you. I've had plenty of patients who also have had emergency C-sections that go from the belly button down here. They have C-section scars that are pretty high. I've been able to actually remove all of those and give them nice low scars. User long number. Do you do surgery at the hospital? I have privileges at the hospital, but the majority of the patients, the procedures that I do are at a standalone same-day surgical facility that is accredited. Brains by desire. Do I need to come to Houston for? No, you don't. I've already answered that question. You don't have to come in for an in-person. If you can, absolutely, we'll be happy to see you. Otherwise, we will start with a virtual consultation. Recovery, health, and wellness. How do you feel about lymphatic massages following all surgeries? I have my patients do lymphatic drainage treatments after they've had liposuction. If they haven't had liposuction for me, they don't require lymphatic drainage massages. Jessica, can you do a paniculectomy and a body lift at the same time? Yes. So the body lift encompasses the paniculectomy. So in other words, this patient has had a body lift. Body lift is more powerful than a paniculectomy. A paniculectomy, if I were to do a paniculectomy on this patient, her scar will go from right here. You kind of see where you can see the unaware. This pannus is kind of overlying it. The scar will go from here to about the other side. And it will just remove this part, this big part that's overhanging. It will not fix anything on top of her belly button. It will not displace her belly button. It will only cut this part out so that she doesn't have that big apron. That's the paniculectomy. When I do the body lift, I do the paniculectomy and a whole lot more. Tummy tuck, repair of the muscle separation. I put the belly button where it needs to be, make it really nice. I fix the mons pubis area, elevate that, contour it. I actually fix the hips and the buttock. So it's a much, much bigger procedure that encompasses paniculectomy. User long number. I am a very healthy 73-year-old. Can I get a tummy tuck? Absolutely. Absolutely. We've got one who is now, I think when she had her body lift, she was either 71 or 72. She had this full procedure, did extremely well. And she's actually wanting to come in for other procedures as well. So we're looking forward to taking care of you. We will be happy to take care of you as well. Christina Wilson, do you do fleur-de-lis tummy tucks? Yes, I do. This is a fleur-de-lis tummy tuck. I know it's hard to see, but her scar goes midline here. It allows me to actually remove a huge amount of excess skin that goes in this direction from side to side, in addition to the one that goes top to bottom. But yes, so I'll do the fleur-de-lis technique in specific patients that will benefit from it and that are okay having that scar in the midline of their abdomen. Not everybody wants that. So we discuss it. Like I said, I give you my recommendations, we discuss things, and then we go together. We come up with a treatment plan that will benefit you the most. For pricing, everybody, please contact us. My patient coordinator will be happy to discuss this with you. We'll give you some ballpark. We need more information to see what surgeries you want to have done, but I can tell you definitely the drainage tummy tuck, it usually starts at $13,000, and that includes anesthesia fees, facility fees, surgeon's fees, all your post-op garments, your post-op care, your post-op scar cream that we have compounded specifically for you by the pharmacy and shipped to you. All right, we are coming up on an hour very shortly. I think we probably got another 5 or 10 minutes and we will be finishing up. But thank you very much, everyone, for participating. I really appreciate it. I look forward to taking care of you. And for mommy makeover, so price mommy makeovers vary depending on what type of procedure you want to have done, but definitely come in and see us. Usually they will probably run around $15,000 to $30,000, 30,000. So, but it depends on all the types of procedures that you put in. Body lift as well, all depends on what it is. It's usually around anywhere between 16, 18, sometimes even $20,000, depending on what type of surgeries you've had, if there's scar tissue, and what exactly we put in your body lift. So everybody's different. So we definitely, but that's kind of like a ballpark, but definitely call us, contact us, 281-724-3138. My patient coordinator will be happy to discuss this in greater detail. We'll be able to get more information as well from you to understand and guide the conversation. And then we will be happy to book you for your virtual consultation if you're not in the Houston area. But if you are in the Houston area, by all means, come in person, and we'll be happy to take care of you and get the ball rolling and get you guys on the surgery schedule. You're very welcome, everybody. Thank you very much for your questions. I appreciate it. Again, I do these Q&A live sessions every Tuesday and Thursday, time permitting. Usually start around 7-ish Central Standard Time. Hi, Vicky Ahisu. Nice to see you. And we will definitely be happy to have you guys come in for your consultation, like I said, in person, if you're in the Houston area, or virtually. We will do a virtual consultation for all of our out-of-state patients, out-of-town patients, and out-of-country patients. This is our phone number, 281-724-3138. Contact us, and we look forward to taking care of you. A couple last questions before we part ways. Let's see. I know people have asked about mesh support, especially when we do the breast reduction or breast lift in patients who've had a lot of weight loss. Yes, the mesh support is something that I place for my patients because it really helps to counteract, I guess, the effects of gravity and time. Unfortunately, time and gravity always win, but placing the mesh will actually prolong good results for a much longer time, to really push that next surgery down the road much, much farther down. So mesh is one of the things that I use. And if you want to combine it with a breast augmentation, so if you're getting a breast lift and a breast augmentation, but you've had deflated breasts, you've had a lot of weight loss, we will combine that also with mesh support to really help with the healing process, where it actually helps to hold your breast tissue in place, and it helps settle in the scar and support the breast implants as well as you recover. So definitely plenty of options that we offer for our patients, and we are always happy to meet you guys either virtually or in person. Thank you very much for following us. Any other questions? I think we probably have a few more. If not, then we will wrap it up. I think cost, we talked about costs. Thank you very much. Thank you very much. Again, for those of you who are just joining us, this is our phone number, 281-724-3138. Please contact us, text us, call us. If it's after business hours, just leave a message. We will get back to you. Or also put in your information in the lead form here on the bottom left. And then if you go to my profile on TikTok, you'll also see a form that says get quote. It should be there. I know TikTok has been having some updates, and so they removed the form for about 2 weeks, but it should be back. Click on that, put in your information, name, phone number, email, and what procedures you're interested in, and we will be happy to get in touch with you, guide you through the process, get you on the books for your consultation and your surgeries. Again, it's $150 for you to book your appointment. That goes towards your surgery when you book your surgery with us, and essentially gives you a free consultation. So the quote that we give you during your consultation is good for 6 months. So we're pretty much for the rest of the year. So book your appointments down, get your quotes, lock in the prices before they go up. These are some great deals that we are offering. And so don't hesitate. Any other questions? I think we're good. Pretty hazel eyes. I've lost 145 pounds. I need this. Wonderful. Congratulations on weight loss. We will be happy to take care of you. By all means, contact us. Like I said, 281-724-3138, and we will be happy to take care of you. Please go through my TikTok feed. We've got plenty of patient testimonials, before and afters, patients who've gone through all of the procedures, who've come in and had 2 stages. Some are getting ready for their 3rd stage surgery. So by all means, definitely contact us and we'll be happy to take care of you. Okay, so Sinchis Rodriguez is saying, what's the BMI criteria? Just join, max BMI 35. But I will do a case-by-case basis as well, so it depends on where you carry your weight. Miss Tasha 60628, do you take insurance? No, our office does not take insurance. These procedures are not covered by insurance. They're considered to be elective cosmetic aesthetic procedures. So our patients will pay out of pocket. We do offer financing options, so please contact us. Put in your information in the bottom left of the screen there. We will reach out to you. My patient coordinator will guide you through the process. Okay. Well, thank you very much, Jackie Marie. I think Monica Jackson, I saw you pop up. I hope you're doing well. Thank you so much for the follow-up pictures. And anybody else who's been following us, we are very happy. Okay, so your insurance is paying for your tummy tuck. We don't take insurance, so you have to make sure that they will reimburse you. We've had some patients who come in, we give them codes, the insurance will reimburse them, but you will pay us out of pocket, and the insurance will reimburse you. So if your insurance is ready to do that and able to do that, by all means, we will be happy to take care of you. Excellent. Congratulations on your weight loss. Thank you very much, everybody, for following us and for participating. Until next time, hopefully we'll see you for your virtual consultation or in person. Otherwise, we'll see you at the next Q&A live session, Thursday, 7 p.m. Houston time. God bless you. Take care. Have a good night. Will do. See you, Jackie Marie. Okay.